I am Professor Manavalam, working in SNS College of Nursing. Now we are going to see yet another interesting topic. It is a continuation of abortion. The causes of abortion. Early we have seen what is abortion, what are the different types of abortion. At the same time, we have to know what are the reason the abortion has happening. There are two different causes are there for abortion. One is fetal causes, second one is maternal causes. First we will see about the fetal causes. The first and foremost reason of fetal causes is genetic factors. In these genetic factors, the first may be with the chromosomal abnormalities. In this chromosomal abnormality, the right side, some of the things they have given the abnormalities of in genes, chromosomal abnormality. Some of the normal, it may have the 2n, the chromosomal after the cell division. Sometime instead of 2n, extra one more chromosome that is present either from the paternal or maternal means then it is called as a trisomy. It is one of the abnormal chromosomal abnormalities. Sometime from either one of the parent they are not getting one set of chromosomes that is called as a monosomy. So everything, if it is going extra or if it is going lesser, everything is considered as a abnormal that ends up with abortion. This is one of the things. Next, apart from that, some structural abnormalities that is happening in the chromosomes. Maybe a duplication of chromosomes, inversion of chromosome, or deletion of chromosome, or insertion of chromosome, or sometimes translocation of chromosome. See, these are all some of the structural abnormalities that has happening. So this is the main cause for abortion, fetal cause of abortion. Next, move on to the multiple pregnancy. 2 or more fetuses that is present inside the uterine cavity means automatically some of the fetus they doesn't get the adequate amount of oxygen and nutrients. So sometimes twin to twin transmission may occur, one twin getting more amount of blood supply, one twin is not getting adequate amount of blood supply and nutrients, that is end up with both the twin may have the abnormalities, it is end up with the abortion sometimes. Degeneration of the chorionic villi. Chorionic villi, it is a factor from this, the placenta which will be getting developed. So the chorionic villi, if it is not generating properly, means there is a abnormalities in the placentation. So the placenta is getting abnormally formed means automatically the fetus won't get the adequate nutrients and for its development. So that cause for fetal loss. Next, move on to the maternal causes. So mostly 40 to 60% of cause for maternal cause for abortion is unexplained. The exact cause is unknown, but sometimes they are describing some of the factors may be contributing for the abortion. In that, the first one is infection. The infection may be the viral infection or bacterial infection or parasitic infection. But most probably the viral infection, there may be a rubella virus or HIV virus. In bacterial may be a bacterial, any type of bacterial infection. Parasitic, example malaria. Maybe in bacterial chlamydia. Maybe these are all some of the infections that is cross the placental barrier and it causes fetal abortion. Next, move on to the contraceptive agents. The oral pill doesn't have that much of effect on the fetal development, but IUD, it has its effect on the sometimes in the IUD it is not failure of intrauterine devices sometimes may cause for pregnancy, unexpected pregnancy. It may be end up with the abortion. Next, continuation of this, the metabolic factors, 10 to 15% it is contributing for the abortion. Then the first one is luteal phase defect. Luteal phase defect may cause for there is a imbalance of in progesterone and estrogen hormone that may be essential for continuation of the pregnancy. If the less amount of progesterone that end up with improper fetal development and it is not supporting the growth of the fetus. Thyroid abnormal may be hyper or hypothyroidism. Both the things is cause for abnormalities. Mainly it is producing the thyroid autoantibodies. It causes for fetal abortion. Diabetes, uncontrolled diabetes mellitus, it is having the major contributing factors for the fetal loss. Next, move on to the anatomical abnormalities. This also contributing 10 to 15% of cause for abortion. In this first one is cervical uterine factors. In this cervical incompetence and insufficiency. In this cervical incompetence, the cervix cervical loss, it lose its power to withhold the product of conception, that is fetus or embryo. So automatically the products, it will be expelled out through the opening cervical arch. So this is one of the major factor of second trimester abortion. Next, a continuation of this is congenital malformation of the uterus. Maybe the uterine didelpus or arcuate uterus or unicornuate uterus or bicornuate uterus or septate uterus. All these different type of congenital malformation of the uterus is cause for reducing the uterine volume, reducing the vascularity of the placentation, and it is reduce the place for growth of the fetus, and it is increase the uterine irritability. So because of these reasons, there is a higher chance of abortion. Next, move on to the uterine fibroid. There are different types of uterine fibroids are there, but submucosal fibroid playing a major role in case of abortion during the second trimester. It causes for uterine irritability, and also it is reduce the vascularity of our placentation. Next, move on to the intrauterine adhesion. So it is cause for reducing the intrauterine volume for the fetal growth, and also it is increasing the placental insufficiency. Through that it causes for fetal loss, that is abortion. Next, move on to the remaining maternal causes. That is first in this immunological disorders. It is contributing 5 to 10% of cause for abortion. That first one is autoimmune disease. Here their maternal own antibodies, they are playing against their own tissues and cells. So that is called as autoimmune. So certain autoimmune disorders the mother is having means it is automatically rejecting the fetus as a foreign entity. Next, autoimmune disease. So autoimmune disease means most of the maternal immune system, they are considering the paternal antigen as a foreign entity. So in order to show as a protective mechanism, it is blocking the that antigen. So it end up with the rejection of the zygote. It is end up with the rejection of zygote that cause for abortion. Next, anti-fetal antibodies. T helper cells and cytokine cell. These are having certain abortion genes in it. So it causes for fetal abortion. Next, to move on to the environmental factors. Here the cigarette smoking, alcohol consumption playing important role. Cigarette smoking, it is automatically cause for formation of carboxyhemoglobin. It is reduce the oxygen supply to the placenta. Excessive alcohol consumption, it is reduce the growth of the fetus. Next, to move on to the logs, maternal medical illness. The mother is having cyanotic heart disease means automatically already they are imbalanced state of maintaining the intake and the cardiac intake output. But in this pregnancy state is a state of increasing the cardiac volume, and also it has to do overload in order to make to supply to the fetus, extra supply to the fetus also. So the already the heart is inefficient to do its action means automatically it end up with it is not able to do its function properly. It is end up with abortion. Next, hemoglobin abuse. The mother is having a history of hemoglobin abuse also, that leads with abortion. Thank you all. I understood that many of you got a clear idea about what are the causes of abortion, and most probably during first trimester the genetic factors under this chromosomal abnormality, endocrine factors, and also the immunological disorders, environmental factors. This is playing key role for first trimester abortion. During second trimester, most of the anatomical malformation, cervical incompetency and uterine malformation, uterine fibroids are playing major role for second trimester abortion. I think everyone got idea about the causes of abortion. Thank you all.